In looking at other aspects of workplace safety, do you have to undergo training for bloodborne pathogens? So having gloves, having barriers for CPR. Do you have to deal with needles in your work? Is there being blood drawn? So how do you use personal equipment? How do you dispose of it? If you have any chemicals, such as pool chemicals, other types of chemicals, if you have a lab, some sort of lab, blood lab, how do you store these chemicals so that they just can't be accessed by anybody? Having things labeled biohazard so that people don't go, touching things that they should not be touching. Provide signage for any risk of exposure. If you're in a lab and you work with isotopes, some people maybe have to have wear the dosimeters to monitor radioactivity exposure. And then procedures in place for workplace injuries. You get injured on the job, where do you call? So, if I have an accident at work, if I trip and fall while I'm teaching lab, then there are procedures in place so that I can have that looked at. So there's a lot to think about. So it's not just if you want to own your own business or clinic that, you just, hang out, make flyers and start a social media site. There's a lot involved behind the scenes that you have to do to get ready, and that there are standards on facility layouts. The ACSM guidelines are guidelines, but they are a standard of practice, and you are going to be held responsible for those with your level of training. So if you want to just go through these, again, know the different types of tests, the graded exercise test. What are the other tests that can be done when the person is suspected of having heart disease, such as the exercise echocardiography, the nuclear testing, and angiography? Know what is cardiac rehab. That could be a great part 2 question on a test. Describe benefits and the phases of cardiac rehab. How does it work? Assess risk for your facility. Develop appropriate emergency procedures and practice them at least quarterly. Okay, so based on our class today, who is the most likely to get referred for cardiac rehab? So think about that for a second. So what gender is most likely to get referred? So it's probably going to be male. And it's also going to be someone who's actually had a cardiac event. So it's not somebody that just has risk factors. So a man with high blood pressure is not going to be referred. A woman with breast cancer is not going to be referred for cardiac rehab. There are specific cancer rehabs. A woman with CABG would be great, but it is still likely to be the man with a heart attack who is going to be referred.